So the Canadian Coalition for Green Healthcare was started about 13 years ago, and we've been working with the Ontario Hospital Association for about 11 of those years to put together the green lane. So every vendor that's in this green lane here at HealthAchieve, they've made application to be here, and we look at the products and services that they sell and whether we really feel they're of strong enough green integrity to be in here. So everybody here has been vetted, and whether it's lighting, whether it's imaging, whether there's people here that do all sorts of environmental service work and provide environmental products. And the coalition works with the Ontario Hospital Association to help sell these booths, to help look at all the applications to make sure that they should be here. And I think this is year 11 for this. So this is the largest collection of green vendors in healthcare in Canada that come here to this event. The Ontario Hospital Association and the Canadian Coalition for Green Healthcare, we do this green event here, the Green Lane. We have an education session, runs for an hour and a half to 2 hours on Monday. And this year, for example, we had two presidents and somebody else and a vice president from hospitals promoting the idea of the hospital executives actually getting in behind and supporting the whole idea of green. A lot of hospital executives, they don't really buy into the idea yet. There's a lot of converted CEOs and vice presidents across Canada, but we really need all of them to buy in, to give mandates to people within their facilities to embrace green so that they have the manpower and the dollars and the permission to go ahead and address green, whether it's green lighting, whether it's flooring, whether it's local food, whether it's getting rid of DEHP, whether it's greening the OR. So if you stand in a hospital and look in any direction, there's something there, probably more than one thing, that can become green. It could be paint, it could be the elimination of mercury-based thermometers, it's getting local food into the food stream. Just on the topic of local food, we've done some research in southwestern Ontario. There was a buying group for hospitals pledged to put 5% local food into their food stream. They were able to do 15% without very much effort whatsoever. That's translated into, I believe it's $1.65 million worth of local food over the last 2 years. So if you look at where all your food comes from, if you were to actually plot all that out, you'd see that you're having food come from China, India, maybe there's some foodstuffs come from Africa, from Europe, from California. If you reverse that flow of food, that's where your food dollars are going. So if you can keep 5, 10, 15, 20% of that in this case in Ontario, I believe local food in that study was defined as Ontario. So that's $1.65 million that stayed in the Ontario economy. So if you can do that all across Canada, then that could potentially get into the billions of dollars that stays in Canadian economy, and it helps support local farmers, it helps support local growers, distributors, all that sort of thing in terms of local food. So that's part of what the Canadian Coalition for Green Healthcare has been doing.